Emergency room physician Dr. Amanda Torres thought she understood death until she met Mr. Peterson. The 74-year-old patient died during her night shift. Cardiac arrest, failed resuscitation, death declared. His family was notified and began making funeral arrangements. Then, 15 minutes later, he sat up in bed with normal vital signs, completely unaware that he'd been clinically dead, sparking the most disturbing case of her medical career. City General Hospital's night shift was usually Dr. Amanda Torres' sanctuary. After 12 years in emergency medicine, she preferred the quiet hours when the chaos of daytime emergencies settled into manageable routines. But this particular shift would challenge everything she thought she knew about medicine. Mr. Peterson arrived earlier that week for cancer investigations. At 74, he was a gentleman who always asked the nurses about their families and thanked everyone for their care. When Amanda began her shift, Nurse Kelly mentioned that Mr. Peterson had requested to see a doctor. "Nothing urgent," Kelly explained. "He just wants to know when he might be discharged." Amanda found Mr. Peterson sitting up in bed, alert and conversational. "Doctor, I was wondering about going home. I feel fine, and I know my son is worried about the hospital bills." "We need to complete your workup first, Mr. Peterson," Amanda explained gently. "The oncologist wants to run a few more tests to rule out malignancy. I know it's frustrating, but we want to be thorough." He nodded with understanding. "Of course, doctor. I appreciate everything you're doing." 2 hours later, everything changed. Code Blue, Room 237. Code Blue, Room 237. Amanda ran toward Mr. Peterson's room, finding him collapsed in his chair beside the bed. Nurse Kelly was already preparing emergency equipment. He was sitting up, talking to his roommate about his grandchildren, Kelly said breathlessly. Then he just stopped mid-sentence and collapsed. What followed was one of the most disturbing resuscitation attempts Amanda had ever experienced. Mr. Peterson had arrested while sitting upright, and moving his rigid body to a supine position for CPR proved extraordinarily difficult. But the truly unsettling part came during the resuscitation itself. Even as they performed chest compressions, even with no detectable pulse or blood pressure, Mr. Peterson's eyes continued to move. Not the vacant stare of cardiac arrest, but deliberate, tracking movements that followed the medical team around the room. He blinked periodically as if aware of what was happening around him. "This is really unsettling," whispered Dr. James Morton, the anesthesiologist who'd joined the code team. "I've never seen eye movement like this during arrest." For 40 minutes they worked. Chest compressions, medications, electrical shocks. The monitors showed flat lines. Mr. Peterson's pupils became fixed and dilated. No heart sounds, no pulse, no signs of life except those haunting, blinking eyes. Finally, Amanda made the call. Time of death, 2:47 a.m. The hardest part came next. Amanda stepped out of the room to call Mr. Peterson's son, David, who lived across the country. "I'm so sorry," she told him. "Your father went into cardiac arrest earlier tonight. We did everything we could, but we weren't able to revive him." David's sobs echoed through the phone. "I should have been there. I should have visited more. Oh, God, Dad." "He wasn't in any pain," Amanda assured him. "It happened very quickly." As Amanda began preparing the death certificate, she heard Nurse Kelly's voice from down the hallway, not calling for help but shouting in what sounded like panic or disbelief. "Dr. Torres! Dr. Torres, you need to come here right now." Amanda rushed back to room 237, expecting to find a family member or perhaps an issue with postmortem care. Instead, she found something that defied everything she knew about medicine. Mr. Peterson was sitting up in bed, very much alive. His pulse was 90 beats per minute. His blood pressure was normal. He was moving his hands and looking around the room with clear, alert eyes. "Doctor," he said when he saw her, "I was having the strangest dream. When can I go home?" Amanda felt her legs go weak. The patient she had declared dead 15 minutes earlier was asking about discharge plans. "Mr. Peterson," she managed, How are you feeling? Fine, just tired. Did I fall asleep? I remember sitting in the chair and then… Nothing. Amanda quickly called the ICU to arrange immediate transfer. Whatever had happened, Mr. Peterson needed intensive monitoring. As she explained the situation to the ICU attending, she could hear the disbelief in his voice. You're telling me a patient you declared dead 45 minutes ago is now stable with normal vitals? That's exactly what I'm telling you. When David Peterson arrived at the hospital 3 hours later, he was both relieved and furious. Why did you tell me my father was dead? Do you have any idea what you put me through? Amanda had no answer that would satisfy him, because she had no explanation for what had occurred. 2 hours after being transferred to the ICU, Mr. Peterson arrested again. This time, there were no blinking eyes, no mysterious returns to life. The resuscitation failed, and he was pronounced dead for the second and final time. The Medical Review Board investigated the case extensively. The EKG strips from the first arrest clearly showed asystole, no electrical activity. The documentation was thorough and accurate. Mr. Peterson had met all clinical criteria for death during that first episode. Yet, somehow, he had returned to life with normal neurological function and no memory of the event. In 12 years of practicing medicine, Amanda had never encountered anything like it. Medical literature contained rare cases of Lazarus syndrome, spontaneous return of circulation after failed CPR, but those typically occurred within minutes and involved patients who had never fully met clinical death criteria. Mr. Peterson had been clinically dead by every measure for over 15 minutes, then returned to completely normal function before dying again hours later. Some mysteries, Amanda realized, exist beyond the reach of medical science. Dr. Amanda Torres witnessed something that medical science still struggles to explain. Mr. Peterson's return from clinical death challenges our understanding of the boundary between life and death, reminding us that medicine still holds mysteries we can't solve. If this medical mystery left you questioning what we really know about death and consciousness, subscribe to the Frontline Voice for more unexplained cases from the medical world. Hit like if you believe some phenomena transcend scientific explanation. Tell us in the comments. Have you ever witnessed something in healthcare that couldn't be explained? Share this story with someone who appreciates the mysteries that keep doctors awake at night. Until next time, remember that medicine is both science and wonder, and sometimes the most profound cases are the ones we can't fully understand.